I'd like to comment on ways that we have available to us and we have for decades for the treatment of recession. The first form of gum grafting was done in the mid-1960s, and this is a procedure called a gum graft or a gingival graft, which we still do today. Many, including myself, consider it the gold standard because it is tried and true, it is extremely predictable, and we have patients that had this procedure performed 20, 30, even 40 years ago, where that tissue is still there today as it was, a few weeks after surgery. Procedures since the 1960s, when gum grafting started, have evolved, and as a rule, they have become less invasive. But we need to be careful. The educated consumer, the educated patient, needs to be aware that there's a lot of procedures being touted as non-invasive or extremely minimally invasive that are fads, that are too good to be true. Just like you will find cosmetic medical procedures, you should seek the opinion of a specialist when it comes to the treatment of recession. You should consider all your alternatives, and yes, if caught early enough, and I can't stress that enough, and if treated early enough, you are likely a candidate for minimally invasive alternatives. My duty to you is to show you the predictable way to do this, the long-term solution. I want to do the most predictable treatment option, and that sometimes involves using your own tissue, which is the gold standard, in my opinion, and most surgeons' opinions, and avoiding the quick, easy fix.